Assisting in reproductive and urinary specialties. From this lecture, we will learn the following: the role of the medical assistant and the medical specialty of gynecology, the role of the medical assistant and the medical specialty of obstetrics, identifying diagnostic and therapeutic procedures performed in obstetrics and gynecology, relating the role of medical assistant to the medical specialty of urology, identifying diagnostic tests and procedures performed in urology, and diseases and disorders of the reproductive and urinary system. Assisting with gynecologic patients. Menstruation. The woman's normal cycle of preparation for conception each month is known as menstruation. The menarche is the beginning of menstruation, and it begins when a young girl is in the age range of 10 to 15 years. Menopause. When a woman is no longer considered to be in the childbearing years, the process of menstruation ceases over time, known as menopause. During premenopause, menstrual periods become irregular. The gynecologic exam. The gynecologic exam often includes a question about the timing of the last menstrual period. The patient may also require standard screening exams, including cervical, cytology, chlamydia, gonorrhea, or HIV, depending on the circumstances and history. Licensed practitioner's interview. The medical assistant may be asked to be present if the licensed practitioner is a male and the chaperone is needed to preserve the integrity of the provider. The licensed practitioner will be doing the physical exam, but also expands on the initial interview by asking further questions about factors that could be an indication of possible cancer or sexually transmitted infections. Breast exam. The patient will be asked about the timing of their last mammogram, and her breasts are examined. Patients should be informed that yearly mammograms are recommended starting at the age of 40 and continuing for as long as the woman is in good health. A clinical breast exam is recommended every 3 years for women in their 20s and 30s, and every year for women older than 40. The pelvic exam. The pelvic exam is done to check the internal genitalia, cervix, vaginal vault, internal reproductive organs, and rectum. Inspection is done with the speculum, which is an instrument that expands the vaginal opening to permit viewing of the vagina and cervix. Specimens can be obtained through the speculum, and the most common type is a pap smear. In a process called a wet mount, other specimens may be collected to check for bacteria, yeast, and trichomoniasis, with a mixture of saline added prior to examination under the microscope. Assisting with the obstetric patient. Prenatal care. Prenatal care is encouraged for the pregnant patient to provide assessment for nutrition, exercise, medical monitoring, and childbirth classes. The patient will be scheduled for monthly visits with a licensed practitioner through the second trimester and every other week during the third trimester up until 36 weeks of gestation. After 36 weeks, the patient is seen weekly until delivery. Labor. When contractions or loss of amniotic fluid signal the beginning of labor, the patient will be instructed to go to the hospital for delivery of the infant. Delivery. If labor does not begin spontaneously, the patient may be admitted and given medication to start uterine contractions with a process called induction. When vaginal birth is not possible, a cesarean section, also called a C-section, is used as a delivery method. Breastfeeding and bottle feeding. Human milk is preferred form of nutrition for an infant. Colostrum, the first milk produced after delivery, contains antibodies to provide passive natural immunity to the baby. Bottle feeding is an acceptable alternative with formulas available that are milk or soy based. Postpartum. During the postpartum period, the uterus shrinks back to the pre-pregnancy size. This shrinking can be noted as uncomfortable contractions for the first few days following delivery. Diagnostic and therapeutic procedures performed in obstetrics and gynecology include pregnancy test. Pregnancy tests can be done with a blood specimen or with the first urine of the morning. Because over-the-counter testing may not be accurate, this test is replaced in the medical office. Tests for sexually transmitted infections. Radiological tests, which may include X-ray, ultrasonography, CT scan, and MRI, Because radiation has been proven to cause harm to the fetus, this testing is contraindicated during pregnancy unless the benefit would outweigh the risks. Hysterosalpingography is an X-ray exam of the uterine tubes and fallopian tubes that use a special form of X-ray called fluoroscopy and a contrast material such as air or dye. A mammogram is an X-ray picture of the breast. It can be used to check for breast cancer in women who have no signs or symptoms of the disease. It can also be used if you have a lump or other signs of breast cancer. Fetal screening. Fetal screening is done on unborn infant to detect birth defects such as Down syndrome or spina bifida. A triple screen blood test can be done to test for AFP, alpha fetoprotein, human chronic gonadotropin, and esterol to detect neural tube defects. Invasive procedures may be needed for gynecologic or obstetric tests and procedures. These procedures include Pap smear. A Pap smear, also called a Pap test, is a screening procedure for cervical cancer. Amniocentesis is a procedure used to obtain a small sample of the amniotic fluid that surrounds the fetus during pregnancy. Chorionic villus sampling. Chorionic villus sampling may be ordered for a pregnant patient with a history of genetic disorders. Biopsy. Biopsy is surgical removal of tissues for microscopic examination, generally to indicate if cancerous cells are present. Colposcopy. Colposcopy is a procedure to closely examine your cervix, vagina, and vulva for signs of disease and abnormal cells. During colposcopy, your doctor uses a special instrument called a colposcope. The doctor may recommend colposcopy if your Pap test results are abnormal. Dilation and curettage. A DC consists of widening and opening of the cervix, which is the dilation part, the scraping the uterine lining, which is the curettage part. Many reasons for abnormal bleeding include bloody discharge after sexual intercourse, called a postocoital, can be discovered or improved by this procedure. Stereotactic core biopsy is a fine needle aspiration in which a sample of tissue can be removed from a cyst, lump, or tumor in the breast through a vacuum device. Hysterectomy. The hysterectomy is the surgical removal of the uterus. It may also involve removal of the cervix, ovaries, fallopian tubes, and other surrounding structures. Laparoscopy. It is a surgical procedure in which a fiber optic instrument is inserted through the abdominal wall to view the organs in the abdomen or permit small-scale surgery. Laparoscopy is done to view internal female organs. Loop electrosurgical excision procedure. LEEP uses a wire loop heated by electric current attached to the speculum and can be used to cut away abnormal cervical tissue discovered during a Pap smear. This is used as a part of diagnosis and treatment for abnormal or cancerous conditions. Cryosurgery. Cryosurgery is called cryotherapy and is the use of extreme cold produced by liquid nitrogen or argon gas to destroy abnormal tissue such as venereal warts, precancerous tumors, or to control bleeding. For medical assisting to the medical specialty of urology, the medical assistant will need to understand the urinary system and the diseases and disorders likely to be encountered. He will need to do the following tasks efficiently: collecting and processing urine, blood, and other specimens, obtain cultures, participate in patient education, obtain thorough history relative to urinary systems. Diagnostic tests and procedures performed in urology will include urine and blood tests. Analysis of the urine is called urinalysis and is most commonly ordered test in urology practice. Semen analysis and smears. Semen analysis and smears may be obtained to determine fertility. After vasectomy, semen analysis is done to confirm absence of sperm cells, hence working as the confirmation of vasectomy success. Cystometry. Cystometry is a test used to look for problems with the filling and emptying of the bladder. Cystometry measures the urinary bladder capacity and pressure. Cystoscopy. During a cystoscopy, a doctor inserts a cystoscope, which is a thin tube with a camera and light on the end of the tube, through urethra, which is the tube that carries urine out of the bladder, and into your bladder, so they can visualize the inside of your bladder and examine the walls of the bladder and urethra. Testicular biopsy. Testicular biopsy involves obtaining a tissue sample from the testicular mass for further laboratory study. Common obstetric and gynecologic diseases and disorders include cancer, Cancer may occur in different parts of the female reproductive system, such as cervical cancer, ovarian cancer, and cancer of the uterus. Ectopic pregnancy, endometriosis, fibrocystic breast disease, and fibroids or leiomyomas. Menstrual disturbances include a range of disorders, some of which are amenorrhea, which is the absence of menstruation, dysmenorrhea, which is painful menstruation, menorrhagia, which is excessive or prolonged menstrual flow, metrorrhagia, which is bleeding between menstrual periods, ovarian cysts, pelvic inflammatory disease, and pelvic support problems, which include uterine prolapse, rectocele, and cystocele. In addition to this, polyps are growths with stems attached found on mucous membranes of the cervix or endometrium. These can be surgically removed in the office or hospital. Premenstrual dysphoric disorder is a severe form of premenstrual syndrome, or PMS, which refers to physical and emotional symptoms that occur in the 1 or 2 weeks before a woman's period. Sexual function disorders and vaginitis, the inflammation of the vagina that can result in discharge, itching, and pain. Epididymitis is the bacterial infection of the epididymis, which is usually treated by rest and antibiotic medications. Hydrocele is an excess fluid in the scrotum, usually caused by an infection of the epididymis or testes. Impotence is an inability to achieve or maintain an erection. Incontinence is a loss of bladder control, and its treatment depends on the cause and severity of the problem. Kidney stones are caused by chemical substance in urine which form crystals or stones, which may pass spontaneously but may need surgical crushing as well to assist in the process. Prostate cancer, prostatitis, which is the inflammation of the prostate, prostatic hypertrophy or hyperplasia, which is enlargement of the prostate gland and results in constriction of the urethra, causing difficulty in urinating. Sexually transmitted infections, and urethritis, which is the inflammation of the urethra, which usually caused by a bacterial infection. That concludes today's lesson. Next, we will be going over collecting, processing, and testing urine and stool specimens.